Hello ladies and gents, I'm Nurse Dad, former Navy hospital corpsman and current ER nurse. On this episode, I'm going to demonstrate how to hang IV fluid with IV Piggyback. So what is IV Piggyback? Well, let me explain it through an example. Say you have a patient who had a syncopal episode. They were dehydrated and they fainted. And when they hit the deck, they hurt their knee. The doctor ordered sodium chloride to help hydrate the patient. But the patient's also suffering from acute pain from that knee injury. So the doctor also ordered, we're going to pretend here, a gram of IV Tylenol. We're going to grab our IV tubing. I've seen variations, but this is basically it.
Do you ever win a fight?
Nobody ever wins a fight.
Now, when you get your IV tubing, the first thing you want to do is you want to shut it. Right like that. You have a cap. And this bag has two ends. This end is for medication. So you would draw up the medication in the syringe and you can eject it through here. Blue cap. When you spike the bag, you're going to want to turn and push. So right here, I'm going to push it in, and as I push in, I'm going to turn. You want to fill this end with a little bit of fluid. Remember, we closed it, so there's no fluid that's going to go down the tubing. You could take the cap off. Instead of opening it all the way, you want to do about halfway. The fluid, as you can see, it's going down the tube. The reason you don't want to open it all the way is that the tube fills with fluid so fast that you sometimes get too many air bubbles. Tiny air bubbles aren't a big deal, but if you're going to attach this to, say, a pump, the pumps are very sensitive. Encountered a popular belief among non-medical personnel. You're always going to have a few little bubbles. That's going to be fine. All right, so the IV tubing is filled with the fluid. I've shut it again. This part will get attached to the patient's extension tubing. But in this scenario, the patient isn't going to get this fluid first. They need to get the IV Tylenol for pain management. And once the bag of IV Tylenol is complete, that's when the sodium chloride will take over. This is the tubing for the Piggyback. They typically come with this, one of these. Let's say you had one hook. The way that IV Piggyback works when you're hanging anything by gravity, gravity will push down the first bag first. In this case, we want the IV Tylenol or the make-believe IV Tylenol. So if you only have one hook, you would hook your primary bag and you would attach it like so. Now this isn't a real IV pole, but we're doing the best we can, right? The tubing for the IV Piggyback is not that long. It doesn't need to be because this tubing will not be going to the patient's extension tubing. This is going to be attached to the primary tubing. You have your cap. We want to close it. Same principle. Take the cap off. Push and turn. Fill this up about, usually go about halfway, 2/3. That's fine. Now from here, same thing. We're going to fill it up with the fluid. Open it up a little bit. There we go. Before I take the cap off, I'm going to look to where I'm attaching it. This is the primary tubing. This is the Piggyback tubing. On the primary tubing, you have this hub. All right. Uncap the Piggyback, and you attach it to the hub. Of course, I'd be wearing gloves. Again, this is just a demonstration. From here, if you recall, the primary tubing is still shut. I'm going to pretend the IV tubing is attached to the patient's extension tubing. If I open this up, anything that's in this bag is going to go into the patient. Depending on the order or the medication, I'm going to open this up to various degrees. It could be a little bit for a slow drip. It could be halfway. So IV Tylenol, usually you can infuse it pretty quickly. So I'm going to open this up. When the Tylenol is finished, the sodium chloride will take over. And that's basically it. Despite serving in the Navy Hospital Corps for 7 years, I didn't even learn how to do this until I was a nurse myself. I worked primarily out of clinics or I was in the field with the Marines. I usually had to deal with patients one at a time. So if I had a patient who was dehydrated or needed a medication, I can kind of work exclusively with them. If they needed a bag of lactated ringers, I would give it. If they needed a second bag, I would just hang the second bag up after the first bag. So for years, I just hung one bag at a time. Not until my first job as a nurse, I was working in an ICU step-down unit. Patients were coming in, they needed a lot of help. And when you're a nurse in a hospital, you have multiple patients and things can come up at any time. So if you think you're going to hang one bag of fluid and be there on time, say 15 minutes or 30 minutes after infusion to hang the next bag, it's not going to happen. So for the first time in my medical career as a nurse, it was no longer safe for me to hang one bag at a time. I had to be able to hang multiple bags, utilize IV Piggyback in order to best treat the patient. But it was kind of embarrassing. At this point, I had 7 years of medical experience in the Navy Hospital Corps, 4 years of nursing school. My first job is an ICU step-down unit, and I don't know how to utilize IV Piggyback. To make the long story short, I asked somebody and I learned very quickly. As you can see, it's not that difficult. But the reason I brought this up is because everyone has questions. I don't care how good somebody is. I don't care if they're a doctor, a physician assistant, a nurse practitioner, a nurse, a CNA. Everyone has a question about something. Now, a lot of people won't admit that, and many people certainly don't feel comfortable asking questions. In my example, I'm coming from nursing school, 7 years in Navy Hospital Corps, where I was suturing patients. I was certified to do a needle thoracentesis, a crike, many procedures I can't even do as a nurse today. And yet I couldn't hang an IV piggyback. So I wanted to admit this, let you guys know that if you have any questions, ask somebody. There should be no ego in medicine because remember, it's not about you, it's about the patient. There's no shame in asking questions, and you're never going to learn everything. I hope you guys like this video. Now, if you're a student nurse or a novice nurse or even an experienced nurse and want to be part of a community, subscribe to Nurse Dad. Nurse Dad out.